got Dr. Reshma PJ, who has secured rank 2 in the Common Merit List and rank 7 in the AIMS Merit List in the INISS DM Neurology Entrance Exam. So, Reshma, hearty congratulations.
Thank you, sir. Thank you very much.
So, Reshma, first of all, for the viewers, can you please introduce yourself, your MBBS college, and your MD DNB college?
So, I'm basically from Kerala, Trivandrum. I did my MBBS from Government Medical College, Trivandrum, and completed my MD General Medicine from Alappuzha Medical College. And I had completed MD and I had done SRship 1 year and now post MD 2 years, sir.
Fine. So, what was your rank in the previous NEET SS exam?
So it was some near 2600.
1600. So, I think this is an inspiration for others also watching this interview. From a rank of 1600, she has improved to a common merit list rank of 2. So it again shows the amount of hard work that she has put in, and I think the viewers would really appreciate that. Right. Reshma, first of all, let me ask you, what was it like seeing rank 2 against your roll number?
Sir, I was not at all expected, sir, because I think in my life it was first time a single digit rank I'm seeing, and when still I am amazed, unbelievable, sir.
Right. So, coming to your journey with doc tutorials, so when did you subscribe doc tutorials?
Sir, I subscribed during my SRship, sir. Already, I'm for past 2 years I'm following this app.
Okay. So, coming to the lectures of the doc tutorials app, did you go through the entire neurology lectures in the app?
Sure, sir. I had a very good note from your lectures. It was very worth, sir. It was very worth.
So, let me just ask you, see, when you prepare for a INI exam, there are two options, like you take Harrison and read the entire neurology of Harrison. Second is you watch a video and then retrospectively go to Harrison. As a topper, what would you advise to the juniors?
Definitely, sir, the second one. I had first gone through your videos. I had made a very good note, and then I retrospectively gone through the Harrison, especially the tables. That was very, very helpful, sir.
So, can you tell me why such an approach? Because if Harrison has the entire neurology, then why going through videos and then coming to the like the Harrison?
So the problem with the Harrison is that every word, individual word is important. We can't miss anything. But while you go directly to Harrison and start reading from the beginning, yeah, you won't be able to pick up the point one by one. But what in the video, what is helpful is that the whole important point is highlighted there in the videos. And if everything is said in an order, it will be equally easily understood, sir. So we can the notes are very much helpful, and so after reading that note and listening the videos, when you go through the Harrison back, then you can easily note, yes, it's the same thing what you had mentioned in the video, sir. So it will be very much helpful, sir.
Right. So you said about the main videos in doc tutorials. Now we know that neurology is a very vast subject. So because of which we had done the quick revision videos in the app for candidates to summarize, the big topic of neurology, cardiology, like that. So did you get a chance to go through the QRP videos and how beneficial were they?
So it was really helpful, sir. I had gone through. I could only gone through that QRP videos actually. The rest of the videos I couldn't cover during my this study period. So I mainly the medicine part I was mainly looking through this QRP videos. That was really helpful. In a short period of time, you can brush through this point, majority of the high important points which is covered. So QRP videos are just worth to. Yes,
Right.
sir.
So basically, what you're saying is that your style of preparation was for the neurology segment, you watched all the main videos. And then for the medicine segment, since you had a shortage of time, you went through the QRP videos. Am I right?
Yes, yes, sir.
Okay. Now, this is also very important because this happens with many candidates because they might be working just like Dr. Reshma was working. And then, when you are short of time, you can go through the QRP videos where we have summarized the topics into short lectures so that you can finish a lot of topics in a short span of time. Right.
Yes.
So next, after the lectures, Dr. Reshma, coming to the question bank, Q bank practice. So just tell me that for an exam like INI, wherein if you look at the question papers of the last few years, the pattern keeps slightly changing. Certain exams very clinical, certain a mixed bag. Some exams has good number of image-based questions. Certain exams very factual. So, how beneficial was the Q bank, and did it have a right mix of questions?
Yes, sir, definitely, sir. In since as you told, I couldn't go through the core neurology subject in detail. Yeah, so what I done is I just gone through the question bank, and in the beneath that you have given the very well description pattern in the form of box, which is exactly from the Bradley's. So it was really helpful for me, especially who stick on to this Harrison and the videos. So I think it will be helpful if you go through the question bank during your revision time. After revising your Harrison and you are having okay, you are having an idea about a base that is being built up, then you should go through this question bank. You can add on to this lecture and add on to your note already made,
Okay.
and then you finally revise. That will be very much helpful, sir.
Right. And then coming to the elite exams as well, because every year we conduct the elite exams and the test and discussion. So, wherein faculties will be framing questions and we'll be giving a timetable as well. So, how useful were the elite exams in your preparation?
Okay, sir. By that time, you have posted your Elite newer section. I had completed one section of revision. So I thought of setting my mind that I will revise this Elite section topic again and I will attempt that Elite test. And before that Elite test, I had tried to gone through your previous Elite videos, discussion videos also. So that was my goal. I should revise the subject again, the lectures and the extra point and the previous videos. After completing this, I will attempt the newer Elite test. And I think majority of the Elite test I had a very, very good rank, and that again boosted me. Okay, you can perform with this limit, you can do well. That was boosted my confidence, sir.
Now, for the viewers as well, it is very important to give the elite exams because number one, we have given the candidates a definite timetable. So one problem which I've noticed with super specialty entrance preparation is, see, unlike the NEET PG or the INICT entrance exams, wherein as a student you can devote entirely to studies and give yourself a good timetable, when it comes to this age and for preparing for an entrance exam, it is slightly difficult without a definite timetable because you have multiple things on hand. And that is when we thought, why not conduct exams with a definite timetable. And the only purpose is that candidates know that, okay, I've got to write this elite exam, these are the portions that I've got to cover for the elite exam, and let me study according to that, which will give you a direction and a focused approach for your exams as well, which is what Dr. Reshma did as well. And also the viewers should know that we have got the discussion videos as well for these exams, which are uploaded in the app, and even the previous uh, year test and discussion videos are also uploaded in the app. So this one was the third elite season, so the previous season videos are also available in the app. So, Reshma, I just got an overall idea regarding your preparation. So, regarding the lectures that you have watched and then retrospectively going to Harrison, doing the question bank, the elite exams. Now, just one last point, Reshma, regarding the stage two, that is the interview preparation. So, what message you want to give to the candidates? Because how is an interview round different from the MCQ round?
So, in the interview, I think we had only a short period, but you had tried to give us relating 3 to 4 classes. And as you told, I had a mirror in front of me, and I was had a two notebook, and you had given the whole questions which was asked previously. And what you had highlighted is that you should have is how the approach, the clinical approach. It's not just the theory. What you should say, and it's entirely different from MCQ, sir. And the mock sections were very, very helpful, sir. You have attempted to come out from our inhibition, because every time when a question is asked, we have a tendency to say the etiology part or the clinical means the theoretical part only. But what they meant is there's something which is different from you. They are asking mainly how is the clinically how will you approach, or that is it is not that easy. It is entirely different from stage one, sir, where you need ample preparation, sir. um, that you had very well guided us.
So basically, what Dr. Reshma is trying to say is that stage two preparation is very different from stage one. And in stage two, they ask you questions mainly based on approaches, which may be a clinical scenario, an EEG image, or a CT image, or an MRI image. And sometimes some candidates get factual questions also. But I think the style of preparation for interview is very different. And over the last few years, I've been training candidates for the interview as well. So whatever questions have been asked in the previous years, I've got a good collection of them, which were given by the candidates themselves after the interview. So I had shared in that in our WhatsApp group also, right, Reshma, regarding the all the previous year questions, so that the candidates can go through the questions. So I think once you went through the questions, did you get an overall idea before we started off with the mock interview sessions? I had shared all the previous year interview questions. So did that give you an overall idea? Okay, this is what probably they are going to ask me.
Yes, sir.
So with that, then we started off with the mock interview sessions, and in the mock interview sessions, I was just trying to ask similar questions which are being asked in the interview, so that candidates don't have inhibitions. And as Reshma is telling, I have always said candidates to practice in front of a mirror, because you are used to writing MCQs and all, but it's not very easy when an unfamiliar person is asking a question on the other side of the screen, and then you have got to answer spontaneously. So not easy as writing an MCQ. You have got to train yourself, and that is why we conducted some mock interview sessions as well. So, Reshma, thanks a lot for your time. And I think, the viewers also have got a pretty decent idea on the preparation for INI, because your words are very important, because there will be candidates listening to you who will be preparing for the upcoming INI exams. And especially your journey from a rank of 1,600 to a rank of 2. And I understand that you have got a 7-month-old baby as well. I know how difficult is it to manage everything, but I must say that you have done a fantastic job, and I think you've got a very supportive family also, so
Sir,
that you could.
sir, really, sir, please, I need to thank them also, because not only my effort, their pain, their support, my family, my husband, they all helped me a lot. So,
All right. So all the best for your future endeavors, and hoping to meet you in some conference. Okay.
yes.
So thanks a lot. Bye bye.
Thank you, sir.